Hey everyone, this is Dr. Kyle with Ice Clinics bringing you your next tip for Tuesday. So we've been seeing a trend in our clinic lately with a lot of lower back complaints. Some tend to be a little more straightforward and simple. Some tend to be a little more complicated. One of the things I want to talk to you guys about today are the more complicated cases, because I know there's a lot out there, a lot of patients out there that have complicated low back pain that haven't gotten their answers, and this might give you a little better direction as far as where to look. So one thing I want you to recognize in the human body, we have our pelvis is made up of 3 bones, 1, 2, 3. It's got 2 joints on the back and 1 on the front. Most people and a lot of practitioners don't necessarily appreciate the importance of this one on the front. Even though it doesn't have a lot of dynamic movement to it, it kind of acts as like a fulcrum position between the bones on the back. And very importantly, with this pubic bone joint, you have a group of muscles called your adductor muscles that run down the inside of your leg and insert into your knee, also called kind of our groin muscles. Now these guys can become overactive in someone who has a weak glute medius muscle, which is kind of the muscle that allows us to keep our leg lined up relative to our pelvis and our low back. So people that have a weak glute medius muscle tend to have what we call a Trendelenburg presentation, which is basically a hip that pops out like this. And what this does, as you can probably see with me, it shifts my center of gravity to be this way over my hip a little more. And that creates this muscle to be a little more overactive. The problem is when this muscle is overactive based on this shift in gravity, it tends to pull on the pubic bone on that side, and that can cause a little bit of a rotation component with our pelvis. So, for someone that's suffering chronic low back pain, and all we're doing is focusing on these joints or maybe the joints in the lumbar spine, and we're not making the progress that we would expect to, this right up here might be the difference maker. And connecting that with the muscles running down the leg, maybe even potential knee pain on that side, could also be some more indicators of what's going on. So if you suspect this might be the case with you, or you just have a few more questions about your pubic bone, your pelvis, and your low back, don't hesitate to get a hold of us. Again, my name is Dr. Kyle with Ice Clinics. Thanks for watching.